Morning class. Today we're going to be going over chapter 41, Team Approach to Healthcare. Introduction. You are a critical member of the emergency healthcare team. By working as a team, emergency healthcare providers can improve patient and provider safety and deliver better delivery of better emergency care. An area of team healthcare, community paramedicine, and mobile integrated healthcare teams may be the best examples of the team concept of a continuum of care. The structure and effectiveness of emergency healthcare teams differs from system to system. Types of teams. Regular teams, EMTs consistently interact with the same partner or team. Temporary teams, EMTs work with providers with whom they do not regularly interact or may not even know. So once you go start working for a company, depending on if you're full-time or part-time, if you're full-time, you're most likely going to have one partner. So that's going to be your regular team, regular partner. If you're part-time, you're probably going to be working a bunch of different shifts, so you're going to have different partners from shift to shift. Special teams: fire team, rescue team, hazardous materials team, tactical EMS team, special event EMS team, EMS bike team, and hospital patient care technicians. MIH technicians. Groups versus teams. A group consists of individual healthcare providers working independently to help the patient triage, treatment, and transport. A team consists of a group of healthcare providers who are assigned specific roles and are working interdependently in a coordinated manner under a designated leader. 5 essential elements of a group: a common goal, an image of themselves as a group, a sense of continuity of the group, a set of shared values, different rules within the group. Dependent, independent, and interdependent groups. Dependent groups: each individual is told what to do and how often to do it by his or her supervisor or group leader. Independent groups: each individual is responsible for his or her own area. Healthcare providers who work interdependently are functioning as a true team. Effective team performance: a shared goal, clear roles and responsibilities, diverse and competent skill sets, effective collaboration and communication, supportive and coordinated leadership. Communication: team dynamics foster from crew resource management and team situational awareness. CRM recommends the use of the PACE mnemonic: probe, alert, challenge, emergency. Transfer of patient care. Transfers introduce the possibility of patient care errors. General guidelines for a smooth transport or transfer: uninterrupted critical care, minimal interference, respectful interaction, common priorities, common language or system. BLS and ALS providers working together. BLS and ALS care cannot exist without each other. BLS efforts must continue throughout the continuum of care. What may be a paramedic-only skill in your EMS system may be common for an EMT to perform on another. Assisting with ALS skills. Assisting follows a 4-step process: patient preparation, equipment, performing the procedure, and continuing care. Advanced airway and tracheal intubation: insertion of a tube into the trachea to maintain and protect the airway. This is an advanced skill, so it's something that paramedics do. EMTs are not allowed to do this. Patient preparation: pre-oxygenation, so you want to make sure the patient's oxygenated before you attempt an intubation. Apneic oxygenation, so if you forget to pre-oxygenate the patient, it might become apneic. Equipment: PPE, suction unit with rigid and non-rigid catheters, laryngoscope handle and blade, McGill forceps, ET tube, stylet, or tube introducer. Water-soluble lubricant, 10 ml syringe, confirmation device, commercial ET tube securing device, alternate airway management devices. Performing the procedure: perform BVM pre-oxygenation, evaluate for airway difficulties, manipulate the patient. So you're basically going to position the patient on the best way to open the airway and manage it. Attempt first pass intubation. GI uses supraglottic or intermediate airway if unable to intubate. Confirm successful intubation. So you're going to listen to lung sounds. You're also going to listen to gastric sounds or stomach sounds to make sure the tube is properly placed in the lungs. BVM pre-oxygenation: evaluate for airway difficulties, manipulate patient, attempt intubation, confirm intubation, and correct any issues. Continuing care, monitor for absence of end-tidal CO2 level, decreasing SpO2 level, increasing resistance when ventilating, other physical signs of poor ventilation and perfusion, improper positioning or dislodgement of the ET tube. Vascular access, a procedure that gains access to a patient's circulatory system to inject or remove fluids, medicines, or blood products. Patient preparation, position the patient and equipment. Explain the procedure and the reason for it. Ensure the patient is comfortable and calm. Equipment, PPE, properly sized bag or syringe with the IV solution, IV tubing, and drip set. Skin preparation pads, adhesive tape, gauze, commercial IV securing system, an IV pigtail catheter. IV access, venous constricting band, IV catheter, FIO access, any IO needle, mechanical IO driver, insertion device. Spiking the bag, removing rubber pigtail at the end of the IV bag. Slide the spike into the IV bag port until you see fluid entering the drip chamber. Squeeze and release the drip chamber until about half full. Unclamp tubing. Let fluid flow until air bubbles are removed from line before turning the roller clamp wheel to stop the flow. Check the drip chamber. It should be only half full. Hang the bag. Attach a drip set to the fluid bag. Fill the drip chamber halfway by squeezing it. Flush or bleed the tubing to remove any air bubbles. Make sure there are no air bubbles in the tubing. If there are any air bubbles in the tubing, it could possibly get into the patient's cardiac system and could cause a pulmonary embolism. Performing the procedure, stabilize the patient's limbs, provide comfort to the patient. Continuing care, observe the access site for swelling, bleeding, discoloration, and leaking. Troubleshooting team conflicts, the patient comes first. Always remember this on scene. There's going to be times where you're going to disagree on patient care, or how to move a patient on the scene of a call. Just remember, don't let anything personal get in the way. You're there for the patient. You're not there for any personal issues. Do not engage. Keep your cool. Separate the person from the issue and choose your battles. That's a big one. It's like with anywhere. You guys aren't going to get along with certain people, but you're going to have to work with them. And just remember, the patient comes first. Patient safety in every call. So, which of the following is a characteristic of a regular team? So B, members of a regular team consistently interact with the same partner. This allows them to perform as a seamless unit. Special teams serve a specialized role within the larger emergency healthcare team. Groups perform special functions across geographic boundaries. Temporary teams are common in volunteer EMT systems. Essential elements of a group that people must share include So C, it is important for groups to have a set of shared values, how the group wants to get things done. In a group, the focus needs to be on a common goal. Group members must have a sense of continuity and remember that the group may work together more than once in a different configuration. Finally, a group member should put forth an image of the group as a whole, not one person. Members of an interdependent group. So D, members of an interdependent group work together with the shared responsibilities, accountability, and a common goal. People who are part of an independent group focus on the goals of their own individual area. Individuals who are part of a dependent group rely on the leader for task assignments and have limited ability to adapt and deliver critical medical care in an uncontrolled field environment. When a team member speaks, you should repeat the message back to him or her. This is an example of So A, closed loop communication helps confirm that you have heard and understood the message and will act on it. A clear message is delivered when you speak calmly, confidently, and concisely so that the information delivered or the action requested is clear to the listener. Constructive intervention takes place when it is necessary for you to respectfully question or correct a team member or leader. Extend courtesy when speaking politely to members of the group. Team leader. Should be a pretty easy one for you guys. So D, a team leader is an essential part of a successful team. The team leader is often defined by policy, procedure, statute. He or she provides coordination, oversight, centralized decision-making, and support for the team. In addition, the team leader will help individuals to not only do their jobs, but also to work together. The mnemonic B magic helps you remember 6 typical steps of endotracheal intubation. Which of the following is not part of the mnemonic? So B, although patient requires endotracheal intubation, will also require venous access. Gaining venous access is not part of the B magic mnemonic. Performing BVM preoxygenation, manipulating the patient, and evaluating for airway difficulties are all components of the B magic mnemonic. As you ventilate an intubated patient, which of the following observations would cause you to immediately alert the team leader? What issue would arise that would cause you to think that your ventilation is not working? So D, increasing resistance while ventilating with BVM could be indicative of a critical airway or breathing problem, such as an esophageal intubation that needs to be addressed. Other observations that need to be immediately reported to the team leader, including decreasing SpO2 level, especially below 94%, physical signs of poor ventilation and perfusion, and improper positioning or dislodgement of the ET tube. You're assisting the paramedic with vascular access when you spike the IV bag. It is important for you to use So A, sterile technique involves thorough decontamination as well as the use of sterile fields around the procedure and sterile PPE. When you assist with ALS skills such as spiking an IV bag, it is important for you to use sterile technique. Clean technique refers to minimizing the amount of pathogens or unclear materials that you pick up or transfer through the use of routine hand washing. Aseptic technique is often used for fast, invasive procedures such as starting an IV line and refers to techniques that help ensure that pathogens are not introduced anywhere in the procedure. There is no reduction technique. When a verbal transfer of care occurs, all team members should do their best to ensure that So C, whenever the verbal transfer of care occurs, all team members should do their best to ensure that each team member is respectful of each other. Transfer of care should occur in a location with the least interference as possible. The team member giving the report and the member receiving the report should hand off life-saving care to another team member. Finally, it is important to remember that the team members involved in the transfer of care focus on doing what provides the best care for the patient. Your partner is working a 48-hour shift and has had little sleep. He disagrees with over how to position the patient and how you should drive to the hospital. You should So A, if the problem causing the conflict does not directly and immediately impact patient care, it is best to wait until after the call to discuss the matter with your partner. It is also important not even have a heated discussion in front of the patient. Rather than contribute to a conflict, take a deep breath and count to 10. Let cooler heads prevail. Finally, do not involve the patient in conflict. It takes the focus off of patient care.